Thank you, President. My German matter is for the Health Minister. Finally, most people have, or soon will have, had the opportunity to be vaccinated. The people who haven't been vaccinated fall into three groups. The low-risk demographics who have been denied access to a vaccine until recently, people who are unable to get the vaccine for health reasons, and the people who have chosen not to get the vaccine. 2 weeks to flatten the curve turned into a few months to prepare the health system, but then the eliminationist COVID-0 strategy seemed to be working so well, for a given economy-crushing definition of so well, that the government changed tack. The Australian government's bet on the vaccines being a silver bullet against COVID. Our elimination strategy was based on the hope that the vaccines would deliver herd immunity, but that turned out to be a bad bet. If you've had the vaccine, you're probably protected from the worst effects of COVID, but you're still able to spread it. In fact, when you catch COVID, you will spread the Delta variant about as much as unvaccinated people spread the original coronavirus. That's a level of infectivity that the government felt justified locking the entire state down for at the time. It's also a level of infectivity that guarantees that unvaccinated people, including people who cannot get a vaccine, will almost certainly contract COVID at some point, even if everyone else is vaccinated. The only way to protect people unable to get the vaccine is to remain subject to strict lockdowns indefinitely, and that is just not going to happen. So vaccinated people are already protected, and those who are still waiting to get the vaccine aren't at high risk from COVID anyway. This means that the primary beneficiaries of lockdowns are the people choosing not to be vaccinated. Why are we locking down all of society to protect the anti-vaxxers? They don't want the protection, and nobody wants the lockdowns. We are doing this because the government forgot to get the hospital system ready, forgot to train staff to work in intensive care. And now, too many cases will overload the hospitals. The only solution to avoid politically unpalatable deaths is mandatory vaccines. Of course, the government's new roadmap means that many of the lockdown conditions will only apply to the unvaccinated people. That means the government's plan to protect the anti-vaxxers from themselves by locking them in their homes, shutting them out of the economy, and having the police beat them up and arrest them if they try to resist. This seems like a very odd form of helping. You are punishing people for their own good, harming people into health, forcing them to suffer to make them happier. Have you considered that hurting people might not be the best way of helping them? The action I seek from the Health Minister is to abandon the vaccine mandates, triage the hospital emergency beds if we must, deny treatment to those who refuse the vaccine if the system is overloaded. But stop breaching people's human rights. Abandon the coercion.